Alright, the doctor is in here, guys. I got to talk to him.
Alright, Oakley's doing fine. He's awake, but not fully awake.
Right.
And he's on his way to recovery. He may be there now. I took a second to grab a snack.
Yeah,
Calories.
well deserved. Yeah.
His anatomy was very straightforward. There wasn't any real major hiccups. The two arteries were right where we expected them. He had two good veins that went right up the center. You need blood in and you need blood out, so having the arteries and the vein is really great. I modified the implant quite a bit to fit his head better and to fit his earlobe and so forth. He does have all the grafts I talked about, off the scalp, off the left groin, behind the right ear. He's got the brown shrimp sewn behind here. And he's got the rubber mold with the 4 blue stitches and the cup. And the cup has the 2 stitches in the back. It's exactly as I told you about.
Okay, great. Great, so everything went pretty much as planned.
Yeah, he went to sleep well. I wasn't there when he woke up. They were getting him ready. They, take some of the catheters out and get him all situated. And then they move him to the bed and so forth.
Okay, how was the bleeding?
Oh, very little.
Very little?
Yeah,
Okay.
it's pretty standard. There's not a lot of bleeding with this operation. It's it has to almost be done in a bloodless field to be able to see where I'm at. So I use this special Bowie things to allow me to separate the tissues with minimal blood. Because when you get blood, you can't see into the tissues.
Okay.
Right?
Okay.
The tissue that I was able to take from his scalp was long enough to go all the way around the implant. Sometimes it's not quite long enough, and you have to take a second or a third vascular membrane to try to cover the implant.
Okay.
And so
we didn't have to do that. That was good. Okay.
Yeah.
Awesome.
Sounds good?
That sounds great.
Yeah, and the areas have been blocked, but these stitches, when I put them in, he flinched a little bit. He was still asleep, but he flinched a little bit, which means they hurt a little bit, which is what I want. Remember we talked about those 2 stitches being very loose and on purpose. So if the cup shifts forward some, it will pull on the stitches, it will hurt, and he will let you know.
Right.
Okay. And again, I want to emphasize, he won't be able to say, the stitches in the back of my cup hurt. He's going to say, my head hurts or my ear hurts.
Right.
Okay? And so what you have to do is you have to sit him up and say, Oakley, I'm going to touch right back here. And you can almost touch right behind the cup. Right where the stitches, you look at him and does it hurt right here? Just touch the scalp right back there. He'll go, yeah. Okay? Okay. That's when you move the cup back. Just an 1/8 of an inch. Just grab that thing and just slide it back just a little tiny bit.
And will that hurt him when we slide it back?
No, because you're taking those stitches off the tension. It'll make it feel great.
Okay.
You know?
Okay.
You may have had put a baseball cap on and pushed on your sunglasses. It hurts like heck behind your ear, right? And all you have to do is move your sunglasses and pain goes.
Right. Okay.
The skin graft off of his scalp has it's just a piece of fabric, a double layer piece of fabric that's sewn down. Okay. And the scab will form in that. Right. And it'll be kind of raw and sticky, but it will dry out sometime tomorrow. Okay, I got it. Sometimes kids complain of this, but not often. Got it. Okay? Okay. All right, so I've got some pictures here, I'll show you.
Dr. Crawford's
fine.
go? It went well?
Yeah. So the OSSI is in, and it's positioned appropriately in a way that it's not going to interfere with his ear. And also, as I do this operation, I have to keep plastic surgery. We call them lifeboats. You have to keep backup things in place just in case there's a problem with something. So there's a backup membrane on the back of the scalp if there's a problem with healing that can be rotated up. And so I put it in a way to be careful and preserve that. So here he is.
There's a can, I can't see. Oh, God, sorry.
Again, very swollen, and skin grafts have a paler color because they've been detached, and they'll turn pink as the blood flow goes into them. Okay. Most kids swell more than this, but yeah, he's probably about the upper 25% for younger kids.
Okay.
Let me see.
That's unreal.
Here's additional pictures as we rotate his head to the side. Got the earlobe on the bottom, just right. I fashioned the seam of the skin graft as along the edge. And he's got a really nice bump, a tragus bump. That's this thing right here.
Mm-hmm.
It sticks out really nicely. When I take these pictures, sometimes the camera doesn't know what's up, so
Yeah.
there he is from the side. So remember how I said it looks like he's got a canal, big indentation there. And you can see these are little tiny stitches that dissolve, but I remove them. But this only has like a 10% sensation for a few weeks,
Okay.
so that generally doesn't bug him. But around the earlobe, those can be a
So
little
will
sore.
he have a visible scar on his ear?
Well, yes, but you have to look really carefully.
Okay.
And usually what causes a scar is not necessarily the seam, but if he has an area that doesn't heal well. There's a very special bandage that's put on this to help hold everything in place. And if you get a blood bubble underneath it, it lifts the skin graft off of the vascular membrane, and that piece of skin doesn't heal, or doesn't adhere, and so it has to heal in slowly, and that ends up changing the nice color and texture of the skin. It's usually a little bit lighter and shinier, which is what we don't want, but we have to be very careful. So the things that can cause that are being real rowdy and jumping and all that other sort of stuff, and keep him calm, let him play games, right? And basically, my plan is you'll call me tonight when you get to Ronald McDonald House. Keep me inside over the weekend. You can call me if you think, hey, can you go sit on the patio or whatever? Give me a call. Depends on the temperature. I have some of these kids. They have ADD and they're crazy and they're jumping all over the place. And when you do that, the blood pressure goes up and it can bleed some. Make sense?
Yeah.
Okay. So he's got a cup that goes all the way around that, and you can expect some bleeding into the gauze that's along the bottom of the cup. That's normal. If you're concerned, take a picture, send it to me. Is this normal? I'll go, yeah, or no, right? And sometimes he gets a little trickle coming down here.
Okay.
He's got the two rubber tubes, like I told you, that come out up here.
It's a drain.
And they loop around, and they're taped here in the chest. And then the two little rubber bulbs down here.
Okay.
Yeah.
And they're going to show us what to do with that, correct?
Well, yes, but it's fairly straightforward. You just have to keep them compressed and the stopper in.
Stopper in, whatever. Okay.
Okay.
Got that.
Yeah.
And when you see them, it'll make a lot more sense.
Okay.
And you don't need to really empty them and record the output, which is necessary on other kinds of surgeries where there's a large volume of blood loss.
Okay.
These things will leak out maybe 2 tablespoons max.
Okay.
The larger, thicker drain will put out more than the thinner drain. The thinner drain goes underneath the ear and is just sucking everything down just underneath. The bigger drain goes right back here towards the osseous implant and evacuates anything that may want to collect in the entire rest of the dissection. Okay? Anything else I can do for you?
I think you've done a lot, Doc.
All right.
For us. Thank you so much.
Remember, team sport, right?
Yeah.
Okay, and in team sports, sometimes they have to rotate players. So, it's if he's requiring a lot of care tonight, just try to make sure one parent's up and one parent's
That's
We're
like how
figuring
we're saying,
out
one's
time.
up,
Yeah.
one's asleep.
And don't get distraught if he's not sleeping tonight, because guess what? He slept all day,
Right. Right.
right?
He's rested.
Exactly. So, hey, if he wants to play video games at 2:45 a.m., great. Play games.
I'll go play with him.
It's just,
Sure.
yeah, he's just slept for how many hours, right?
Right.
And he's kind of bumped up, right?
Right.
Some kids are like that, some kids aren't. We just have to see. Okay, but it takes a while for his sleep-wake cycle to sort of regulate.
First dose of, was it the
Tylenol?
Tylenol, 6 o'clock coming up.
I think it starts at 9 tonight. First
9
9
tonight.
tonight.
The Tylenol is at 9 tonight.
You got that list, right?
Mhm.
Okay.
Yeah, and he got a dose of intravenous Tylenol in the operating room at 3 p.m.
Okay.
So he's already got that in his system right now. Then you give it to him at 9 and then at 3. Remember?
Right.
Mhm.
Okay.
Question. So Oakley's gonna be so excited to see what 0 looks like. Can we ask you to print out a picture, or
The,
you need to wait?
Well, probably the easiest thing is it's funny, is I used to be able to Bluetooth this to your phones, AirDrop, but it's not working really well. But if I
Okay.
pull this up, you can take a picture of this picture. It's not the
Yeah,
best
let's-
Oh
resolution.
yeah, that's a good
Let's do
idea.
that.
Thank
But
you.
that's what most parents do. And, but he won't understand that this is not the final product.
Right.
Yeah.
Right.
So you have to coach him a lot.
Yeah.
Okay.
Yeah. We'll, I'll talk to him before. we show
Yeah,
him.
I even have parents misunderstand it. It didn't look like that forever. Oh no, we talked about it enough. This is just
There's a
the,
healing part.
yeah, that's right. Let me log in here really quick.
'Cause honestly, Doc, that looked better than I thought it would
Mhm.
with after surgery, you know?
Is it shiny? Okay. And there's a close up of the ear. And let's see, the front one's from the front, but that's another patient. Here's the one from the front.
That's the one
That's
I can't
one.
believe.
That one he's gonna be excited about. right?
Yeah. I kind of took the picture a little too tall coming down. It looked better if I'm straight on.
Now, later on, once he's completely healed, he's good to wear sunglasses.
Oh yeah, yeah. I worked really hard to make sure he's got that groove above there and a nice crease behind. I think you'll like that a lot. Okay?
Thank you.
Alright, what else can I do for you?
Get some rest.
Okay, remember, we're a team, right?
We're a team. We're a team. Defense, offense.
That's
Understand?
exactly
So
right.
that's our coach.
That's right, that's right. And you've got my number. If there's something that you have questions about, I mean, the nurse will want to go through the paging service. You know, oh hell, I got his number on my phone. Hold on a
Do I
second.
have his number saved? I don't know if I do.
I know I do, and I'll give it to
Okay,
you if you want.
okay.
Yeah, and then you just call me from a company. You got a question? Got a question, right?
All right.
Remember the yellow donut pillow? We put a bigger one. So you
I
got the
got it
small
all
one.
set up.
You got the small one, and we
We're
put a
gonna
big
grab-
one on
we're
here,
gonna
so you can
grab
So
choose
his
whichever
feet
one.
are going at the headboard, right?
That's right.
Okay, and then.
The wedges to them, yeah.
Okay.
And often the pillow that you would normally put behind your head, which is not going to work for him because it will push on his ears,
Right.
is best put underneath his knees. Bend
Okay.
his knees a little bit, pack it in there. Okay.
But he's laying on his side though, right?
He can do
Both
either.
sides.
He can put his right ear inside of the donut if he wants to sleep on his side, or he can sleep on his back with it right here.
He normally sleeps on his good
Either
ear.
does right or back. That's what he always
Yeah.
does.
Okay.
So,
And you're going to call me when you get to the Ronald McDonald house. Okay.
call you when we get to the Ronald.
Okay. And tonight it's Gatorade and crackers.
Gatorade and crackers.
Okay.
You can't have really any other food? Not tonight?
Yeah. It's
It's
not
And
worth it.
then tomorrow morning, he's good to have breakfast?
Yep.
Okay.
Yeah. It's just
I'll make pancakes.
it's just a, yeah. Well, you've had nausea and vomiting with your pregnancies. That's
Mhm.
not fun at all.
Mhm.
And so, hey, I tell you, man, if he wants a blue Gatorade or if he wants green and some crackers and just little amounts, so he has time to sort of get it out of his stomach. If he fills his stomach with it, that'll induce nausea.
Gatorade Zero, fine, that's what we got.
Yeah, that's okay. However, the regular Gatorade has sugar in it, and his
Sugar.
body wants sugar.
Yeah.
I'm gonna get him.
Yeah.
Okay.
Sugar for these kids in the first day is kind of a drug
Yeah.
in a way.
Okay.
Yeah.
It's gonna help him recover.
Is there any food that we should restrict him of?
No, not necessarily. Tomorrow he can have what he wants, right?
I could be
I
excited
did
about
have
that.
2 patients in the past year that I was really surprised how poor their nutrition was. So, you know, yeah, sure, he wants Twinkies and stuff like that. That's fine, but he's got to have good,
Right. We're not
you know,
gonna-
proteins and some good carbs and oils and.
We don't really
He
eat
likes
that
his
stuff.
stuff.
Okay.
Yeah.
I'll try
He
him
likes
on
it,
that.
but we don't really give it to him, so.
Mhm.
Yeah.
It's more of a treat for in our house, so.
Well, perfect. That's how it should be. All right. You guys feeling okay?
Feeling that was way
Yeah.
better than what I thought. So, it didn't look
Very
like there's a lot
scared.
of swelling there,
Yeah.
which is
As a
great.
parent though, I think all
Yeah.
of the worst thoughts come
That was
through.
nerve wracking. That was very nerve wracking,
Yeah,
you
it
know,
is.
so.
And I finished at 4. well, that's when I walked out. I
Right.
got a snack. Like I told you, I thought we'd finish up around 4, so
Wow.
pretty
Wow.
straight.
It's amazing. We were thinking you were gonna get done around 5:30.
This sometimes happens.
Yeah.
Just things came together well, and I didn't.
And he woke up good.
I don't know.
Oh, yeah,
He was in the
he
process of
in the
waking
process.
up, and they get the breathing tube out, and I was
Walking
out of the room at that
getting a
time.
snack, right?
Mhm.
All right, well, thanks, Doc.
If there's a problem, they usually just call me back overhead to the room.
Okay,
So,
okay.
Right. I guess we'll bug you. As
Right.
discussed.
That's what he
wants.
And then we're coming back on Monday, right?
yes,
Do we already have like an appointment time scheduled?
I think it's like 1 o'clock, but
Okay.
it's pretty easy. You just call them Monday morning. So, tell them what time. Yeah. Plus, you know that sheet that you took a picture of that has the when he stops eating and drinking for today, that has the appointment on the bottom of it.
Oh, okay, I didn't realize that.
Okay,
Yeah.
great.
So we thought about just driving around, like since, maybe not today or tomorrow, probably later on, probably after Monday.
Yeah.
Maybe just drive around and just go sightseeing since he can't really be out in the heat, would that be fun?
Yeah, that's fine.
Cause yesterday it was cool, we went up to, I don't even know what that area was, we went past Idaho City.
We went up,
Yeah.
what was that, 21, north
Yeah.
21? We
Yeah, that's
drove an hour
my
ago.
bike route.
Oh, is it?
Yeah,
So we went
I'm a
up,
cyclist. I
we
go
were
up.
kinda freaked out cause we're not east of mountains or anything, we didn't know if we were gonna run into bears or something.
Actually, there's 3 campgrounds above that Idaho City, and one of them's called Bad Bear.
Yeah, I saw it.
And
Drove
twice
it.
on my bike, I've had a bear go in front of me.
Oh.
Yeah.
They
Not
don't
big bears.
bother you?
No.
Black bears?
They're
or
black
birds?
bears.
Black bears,
Yeah.
black bears, yeah.
Yeah, I've seen bears a couple times. Had a cougar run in front of me, all on my bike. When I'm
On your
out in the-
bike,
in the wilderness.
wow.
Yeah.
Wow,
Wow.
that's crazy.
Is there any sites that's like a must-see, you think? In the area?
Yeah, there's some cool stuff.
Just want anything
Yeah, I'd say stay kind of close because you might get car sick through Monday. But after
Yeah.
Monday, when I see him, then we'll talk about how much and where and all that other sort of stuff. But
really? Yeah, we're ready
Yeah,
to
there's-
go after Monday. We
there's
wanna
some cool
make sure
stuff.
things in the house
Yeah.
from now till then.
And yeah. And the thing that I think will surprise you is how far things are apart here, and how
Right.
fast everything is.
Right.
Just outside of town, the freeways are 80.
Oh, no.
Yeah, wow, they're 80, wish they were 80 where we live. But we gotta let him go, Ash, he's probably exhausted.
Yeah, he is.
from
No,
what
it's
he
okay.
did, so.
I was just curious.
Yeah. I would probably put, as far as cool things, like what the heck, I think Shoshone Falls are neat. That's down in Twin Falls. It's about an hour and 40-minute drive. And on the way
You looked that
there,
up, didn't you?
Yeah.
on the way there, you can stop right off the freeway. It's called Malad Gorge. Everyone just goes, I mean, it is freaking cool. Little tiny chasm in the basalt with this water rushing through it.
Oh,
Oh,
that's
that's
cool.
awesome.
It's
What did
really-
you call it again?
Malad.
Well, I wanna go to Twin, what he just
And
said.
that's on the way.
That's on the way to
Shoshone
Twin
Falls.
Mm-hmm.
I wanna go there so we can
Maybe
stop
do that
there.
Yeah.
sometime next week, maybe.
Uh-huh. That's easy, and you can come back through the old highway 30 and go by natural springs sort of come out of the basalt into the Snake River Basin, and there's fish hatcheries in there.
Awesome.
Oh,
And,
no.
It's kind of
Well,
cool.
the fish hatchery, it's
You see
fun
them.
fish.
There's sturgeon in some of them, which are these prehistoric fish, like
Wow.
6 feet long.
Oh, wow, that's cool.
Yeah,
Neat, thank you.
that'd be probably the easiest. Yeah, to do with them close by. When you want to go a little bit further, McCall's awesome. It's 2 hours.
Call, okay.
That's a resort town, 5,000 feet elevation with a crystal clear Payette Lake.
Wow,
It's there. Yeah.
wow.
That's cool.
Where's that lake that I was telling you about? It's a very pretty lake, but it's like a pretty big hike.
Mm.
But it is, yeah. Pretty big hike. What's it called? I can't remember.
Once there'll be a lot more that he can do once we take that rubber mold off on day 11.
Okay.
Depends on
Okay,
how
for
it
hiking
heals.
and stuff.
Well, then we don't have the sweat restrictions and heat restrictions and all
Okay,
that sort of
sure.
stuff.
That's
So,
great, that's
yeah.
great.
And that'll free stuff
And
up
the
a lot.
swelling should be done by then?
Yeah,
probably,
yeah, a
I
lot.
guess.
Salt Lake's 5 hours. That's a pretty cool city. You got the ski resorts. You can take a tram up to the top of the mountain. That's 10,200 feet.
That sounds
Wow.
freaky.
And, yeah,
That
ski
sounds
resort.
awesome. He
Okay,
says his
well,
legs
that-
burns when he starts seeing stuff like that. I'm like,
It's when the
Yeah.
kids are around me, that's what I'm like, oh.
Yeah,
Mm.
that's kind of cool drive.
And Gallenberg will never be the same.
Right. Yeah.
All right, I'm gonna head out.
Doc, thank you so much, we appreciate it.
You bet. I'll show you where to.
Call you when we get to the,
Yeah,
to the-
get back to all the donuts.
Yeah. Alright guys, that was the update. Send you another video here shortly.